Hey everyone, thank you so much for joining the Behind Company Lines podcast. Today we have Brooke LeVasseur, CEO of AristaMD. AristaMD is focused on improving patient outcomes through more timely access to specialty care. Brooke, I'm so excited to chat with you. And as we're talking pre-show, not only about your background and your experience within healthcare system and healthcare space, but also thinking about the ways that new technology is disrupting this industry that has a lot of old legacy technology or inefficient processes or outdated process. And it's exciting to talk to companies like yourself to think about how you're increasing the access, increasing the effectiveness of companies and honestly patient and outcomes and the whole care system. But before we get into all that, what were you doing before you joined the company?
Well, thank you, first of all, for having me. It's great to be here. So what was I doing before? Well, I've been in healthcare forever, basically, since getting out of school. My interest in healthcare started way back when I was in high school. I was in a car accident when I was 16 and had a pretty bad back injury. And it was that kind of got me interested in the whole healthcare system. When I got out of school, I went to work for an investment and I was able to get on the team that was writing equity reports about like the orthopedics companies that made the devices and the instruments that actually I had in my back at the time. So that's kind of how I got into healthcare, and I've been in it ever since. That was in 2001. It's been quite a while. After working at the investment bank, I went on to join a bunch of different startup companies, all launching new technologies in the healthcare space, everything from diagnostics to digital health tools. But all of them with kind of a common mission as getting better outcomes for patients in a less invasive, less costly way. I guess that's the common thread. I joined Arista in 2016. And I came on board as chief business officer and then was promoted to CEO shortly after that.
What was the catalyst or what was the inspiration? How'd you get involved with AristaMD and what was particularly exciting about what you're working on now that made the move into the CEO position?
Yeah, so I actually first heard about Arista when they put out a press release. They announced their Series A funding. And in that press release, I was reading through and just hearing about what they were doing to help patients get better access to specialists. And having been through the healthcare system myself, I really, on a personal note, knew what the struggle can look like and thought it was such an amazing solution. Actually reached out to the CEO to congratulate her on what she had built. And she ended up inviting me for a coffee and we really hit it off. And it just so happened they were at the point of time where they were looking to build out a commercial team and bring this kit. And I was able to bring my commercial experience in the space, and she brought me on as chief business officer. So there's a lot of serendipity.
Yeah, it's so awesome to hear about how founders or CEOs, how people have kind of not only are become supporters and fans of companies, but then end up working. You're not the first founder to have gone through that experience or CEO to go through that experience. And I'm curious, within that transition period, thinking about not only what causes a company to seek out senior management or seek out individuals who then become the CEO, but how is that transition in terms of making it a smooth one for the rest of the team, the culture, and still staying in line with the outcomes that you're, I guess, building the path to? What's that transition like? What are some best practices for other maybe founders that are going through that transition and bringing on somebody with expertise that will fulfill a certain outcome that they're looking for?
Yeah, well, I don't even think that it's an issue of transitioning the original founder to new CEO necessarily. Startups go through these transition. In my mind, in my experience, it can be as often as every 9 to 12 months. You're going through a total rebirth and as you mature through the various stages. So I think the one common thing is that they're always going to be changed. And a lot of personnel turnover is inevitable. It's very likely that the team that starts the company is not going to be the team that grows it to 5 million to 20 million and beyond. And so what I think has been important for us as we've gone through some of these growth stages is just to be true to the baseline DNA of the company and the mission. And so for us, that really has been labored. I was lucky to step into a really fully baked idea that came directly from healthcare providers who understood the problem we were trying to solve. The original founder was running a couple hospitals, so she saw the problem right up close and designed the product with like firsthand experience of how this was going to move the needle. So all I've tried to do is keep our eye on the ball, and everyone who joins the company knows that we're here because we want to improve patient access to care. And so when we're looking at who to bring on board, it's not just like skills assessment that we do. It really is sort of a mission set. Like, are you excited about talking about how we're going to improve access and how wait times for patients are going to go down? Because that's like something that you're going to hear every single day in our company. And if that's not something that gets you out of bed, then you're not a great fit. But if it is, then I think that ethos can help you grow through these various phases.
Yeah. It's incredible to think about how healthcare has really gone through a really rapid transition, especially post-COVID, even during COVID, of course, and then post-COVID, thinking about companies and it's becoming more open to digital solutions and creating ways around giving patients access to care and improving outcomes. Why is that? What a part of the system historically has been challenging to, or maybe even more convoluted? Why haven't patients been getting the outcomes at the pace or at the speed or at the ability that they are now? Is it because of technology? What's been a part of the system? I don't want to say broken pieces, but what's been needing of improving, and why now, and what direction is it going in?
Yeah, I think part of it is that physicians have been practicing medicine in a certain way for decades. And to expect them to change everything about what they do to accommodate video or whatever the new single tool is, that's really tricky. And so I think that what's been amazing since the pandemic is that we had this birthing function, right? There literally was no way to get care. We didn't implement some of these digital solutions. So that huge unmet need is what pushed providers to get on board so quickly. And it really helped us scale that huge adoption curve much faster than normal. But it's still changed. And so you look at a lot of the data on telehealth usage, and it's gone back down post-pandemic, not to levels prior to COVID, but it's still down from the peak. But what we've seen is that it's sort of proved to everyone out there at clinics and at health systems and even like in health plans that we can all do this. Like, we can move quickly if we have to. And what's needed is for everyone to just rally around what the problem is and get together to solve it, but that it's actually possible. And so I see a lot of receptivity now to new programs because they've had such success. People are really proud to say, we stood up virtual in 2 days and started doing 90% of our visits over video, right? That was like real positive momentum for these groups. And now, as we're trying to continue to scale our digital solution at clinics, I think there's a much greater receptivity in general towards examining the way that we deliver care and questioning old cool ways.
Yeah. And how have patients, in terms of their behaviors, how have patient behaviors changed in regards to the increase in telehealth, but there's still the necessity to, say, visit a physical therapist in person or some specialist in person to make sure that they can actually alleviate the issue that they're seeing? Are we going to see kind of a hybrid model coming into the future where maybe our primary physician's virtual, but anytime we need to go get specialty care, we're in person, we're accessing? How have the behaviors changed, and are we moving towards a more hybrid technology in-person model for healthcare for the future?
Yeah, I think the way that care is going to be delivered in the future, and it already is happening today, is much more holistically than it was in the past. So it's not just virtual or in person. It's really, providers now have a ton of different tools in their toolkit. They can text patients. They can do video visits. They can collaborate electronically between providers to try and figure out which is with the patient. So there's so many different ways that we can be getting patients care. And patients are, number one, they're consumers, and they expect a great experience. They don't want to be paying more than they have to. They don't want to be taking more time out of their busy schedule than they have to. They really expect to have a good experience and to be met wherever they are. And so what we're trying to do is redesign care so that we're factoring in patient preference, factoring in cost, factoring in what is the actual issue for the patient, and better matching those needs to the right provider, of course, but also the right site of care in the right way.
Yeah. It's so amazing to think about how much more intimate a relationship can be between a practitioner and a patient, being that I feel like in the past few 5 years, it's been a little bit fragmented. Not a lot of people know their primary care physician, let alone go to them regularly. And it's only when there's problems and there's less proactive health. Are we seeing more proactive measures going into kind of healthcare and behaviors in terms of patient behaviors because of the access to technology? And are you seeing a deeper connection between a practitioner and their patients through technology as well?
Well, part of this, I think, has to do with the way that our whole healthcare system is structured. We are very underinvested in primary care. So if you look at the $4.3 trillion that we spend in healthcare, less than like 7% of that is on primary care. But primary care providers are truly supposed to be the quarterbacks of care. So they are supposed to build that deep relationship with the patient and help them move throughout the whole healthcare. And because they're often the first stop for the patient, all the decisions that they make around where to refer the patient or what imaging to do on them, all of those referral and diagnostic decisions, treatment plans, that's where 90% of the cost comes from. So I think what's starting to happen is that we are putting more of an investment into primary care, and we're starting to reward these primary care groups for taking preventative measures and getting patients preventative care, building a relationship with them, not just seeing them when issues arise, but really digging into the populations they're serving. Groups that are doing this well are not just looking at cancer screenings and vaccinations, but they're actually looking at food security. Is my population having good access to healthy food? Are they housing insecure? Are these things that we can help out with? So I think there's a lot of positive movement happening on this front, but we're still early, and our system has been designed for so long around generating revenue from waiting till people are sick and then treating them with expensive intervention. So until we continue to move more into a sort of value paradigm where you're paying to keep people healthy, it's going to continue to be something that we have to work on.
Yeah. Tell us a little bit more about AristaMD and the traction that you've seen, not only historically what you've seen in terms of the traction of the company, but also what you're excited about this year and the next year. And as technology continues to be adopted in healthcare, what's particularly exciting about the horizon in front?
Yeah. So what we do basically is we help direct patients, like I said, to the right site of care, the right provider. And oftentimes what we'll do is we will connect a primary care provider to a specialist to collaborate virtually on a patient care plan. And so what that does is it enables, in most cases, the primary care physician to be the one to carry out the treatment and not require the patient to take more time off work and go travel and wait to go see a specialist who's spending more money. This is something that we're passionate about because right now patients are waiting way too long to get specialist care. There's just a bunch of factors at play. Like one of them is we just don't have enough specialists. We are short. So some projections say we're going to be short almost 100,000 specialists in the next 2 years. So we don't have enough. Yes. And the other thing is we're getting older. So we have this huge aging patient population and they need more specialty care. So if you're referring patients to specialists who really could have been treated at the primary care provider, you're just making this whole thing worse because you're increasing the long wait time, which it's unbelievable when we review wait time data. There are some markets where you could literally wait a year to get a new patient visit with a specialist. That's totally unacceptable. So the reception for what we do is huge just because everyone has experienced this. Even personally, physicians have experienced not being able to get their own care. So that's been really good for us. And post-pandemic, like I said, a lot more receptivity to digital tools and rethinking how we get patients care and where we get patients care.
Yeah, it's fascinating thinking about from the physician's point of view that I don't think a lot of consumers maybe consider their experience, and maybe we all kind of think, I don't want to say selfishly, but obviously we have our own interest in, okay, I can't get the care I need in a certain amount of time. But from the physician standpoint, it must be frustrating to not be able to see patients in an efficient way, provide them the type of care, get the outcomes, or even be in an ambiguous state where, hey, I saw this person 2 weeks ago. I wonder if they're feeling better, if their ailment has improved, if their circumstance has improved. describe some of the challenges that are coming from the physician's point of view and how the technology is able to kind of alleviate a lot of those, whether it's concerns or inefficiencies or even just lack of intimacy in terms of the structure and maintaining a relationship. Speak on that, if you will.
Yeah, well, I mean, you're exactly right. It's extremely frustrating to physicians. In fact, the whole origin story of this company is that the idea for Arista came from complaints out of a local health system in San Diego, where they had over a year-long wait list to get into the orthopedics clinic. And one of the orthopedic surgeons was complaining, saying, this is totally unacceptable. We literally can't get patients in under a year to any of us in the clinic. And the reason for this is that half my waiting room is filled with primary care patients. So if you could solve that, my patients would get in right away. And so that is literally how the idea for the company came about. But no, they're frustrated that patients are waiting. And when patients wait, their issues don't just go away, they get worse. So patients end up going into the hospital and going into the ER to be treated, which is terrible and very expensive.
Yeah.
So we've found that when you can give providers the tools to get patients in more quickly, to ensure that they're being matched to the right provider who actually specializes in the very specific thing that the patient needs, that they're close to the patient's home and they take their insurance. So it's actually that visit will be fulfilled by the patient instead of them looking at their schedule and saying, oh my God, the nearest specialist is 50 minutes away and I have to get public transportation and take time off work and all of that. If we can try and solve some of those issues virtually, that's a huge patient pleaser and it's a huge relief for physicians who are just totally overburdened right now.
Yeah. It's amazing to think about what the technology allows physicians to do, allows patients to do in terms of efficient access to the care they need and not bottlenecking by being in the wrong place and being at the wrong care center in particular. But thinking about the company, whether it's externally or internally, what are some of the biggest challenges that AristaMD faces today?
The biggest challenge that we face is just general burnout and overwhelm on the provider side. The pandemic, I guess, still going. It's rough, right? The providers really were hit hard in the country, as we all know. And so even when you are bringing to a provider a solution that's going to help them, it's a tool that will probably in the long term alleviate stress and be great for patients, it's still change. And so that is a hurdle for us. It's change management every time we go into a clinic. And a lot of providers have been sort of burned on technology. The whole move into electronic health records was not the most seamless change. A lot of funky parts of that road. I think that's really it. It's that providers understand the value that we bring, but being ready to invest in some change management is just the initial hurdle that we're having to overcome.
Yeah. And if everything goes well, what's the long-term vision for AristaMD?
Well, right now we're saving health plans and we're saving clinics millions of dollars every time they implement our solution. They're able to treat 70% of the patients that they were referring out. They can now retain in primary care and treat them immediately. So that's just giant cost savings. And we're going to continue to scale this solution so that every primary care provider out there in the country will have access to our network of virtual specialists. We can consult with them and in most cases support them in treating patients right away, right? So it's number one, just scale. Number two, the whole process of transitioning a patient through the healthcare system is really complicated. There's a lot of stuff you have to do. It starts with finding the right provider. This is something we already solved for. So making sure that the provider is in network, that they're near the patient, that they're a high quality provider. Then you need to be able to actually place that order and talk about old school. Most providers are still on staff. Today, 2023, or on the phone. So we replaced that with something more seamless. It's totally electronic and you're turning its phone and fast, and you can trace all of your referrals and see which patients have been scheduled. And then there's a whole other realm of hurdles involving care transition. So there's often prior authorizations that have to happen. There's the ability for patients to be enrolled in other programs that might be a part of their benefits that they don't even know about. And when primary care providers can get access to all of this data in a really easy way to take action, then we're going to see better patient outcomes because we're getting them the care that actually is available to them, but might be too difficult for us to access.
Yeah.
So that's kind of where we're headed. But our North Star
Yeah.
is always going to be improving access and doing it in a cost-effective way.
I love to hear that. And it's so exciting to hear what the technology will do and kind of how it will compound and have an effect and really alleviate, like you said, a lot of the stress that providers are having and overall kind of disrupt this access and really this process issue behind healthcare and getting the care you need. I always like this next section, I call it my founder FAQ. So I'm going to ask you some rapid fire questions and we'll see where we get. So first question is, just to break into it, what's particularly hard about your job?
What's hard about my job? Probably having enough patients. Healthcare is so slow.
Yeah.
That's my big struggle every day is just staying patient because we are really, really fast and brutally. And it's the whole external market that I can't control that is constantly frustrating. So I guess like exercising patience is one of my things.
Yeah. Yeah. I love that. I love that. What's a particular challenge in working with commercial kind of working in the commercial space? What are some challenges that we may not be aware of working with healthcare, but what are some benefits, say, working within the commercial space outside of working with large hospitals or large organizations? What's some challenges and what are some benefits in addressing the commercial market?
Challenges are, I guess, that every organization is incredibly different. So of course, there are common themes, but when you go to work with a health system, when you go to deploy with a group of clinics, they all have nuances around the population that they're serving, around some of their local challenges. And so you have to be willing to do the work and to dig in and to really understand some of the nuances. That's what ultimately makes our deployment successful. We don't try and just like plug and play the same thing in every single market. Again, a lot of commonalities, but you have to be willing to do that work. And when you do, you can really forge some deep partnerships. So we've put in the work. Some of these relationships take more time than you'd like because they have to be custom, but they pay off. And just to like throw out a couple examples, we are partnered with Stanford Healthcare, who's been a phenomenal partner of ours. But that took a lot of upfront work because when you work with Stanford, you have to customize it and make sure it's completely designed, market, and so on. But now that we're out there, it's just been such a phenomenal reception to what we're doing together. So it's definitely worth it, but it takes upfront investment.
Yeah. Yeah. What's something that you spend too much time on and what's something that you would like to spend more time on as a CEO?
What do I spend too much time on? I don't feel like there's a lot of work that I do that isn't value add, which is amazing. But so our whole, just to back up, like our whole philosophy when we go to market is trying to get providers to like operate at the top of their license. We talk about this all the time. How can we provide the tools so primary care can elevate this, expand their scope of care? How can we make specialists only handle the most acute complex cases? So that whole philosophy, like we actually take internally and we are constantly asking the team to look at like, where do you spend your time and what of it can be automated? What of it can be passed down to someone who is better matched to do this so that we're all kind of optimizing the limited amount of time that we have. So I don't know. I think I wouldn't, if there's nothing to really complain about that I feel like I'm doing too much of it. Every day is different. So there's no one thing that I'm always doing, but that's part of the job, I guess. It's really dynamic, constantly changing.
Yeah. 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 I'm always interested with healthcare because you have so many stakeholders, so many players, you have providers. I'm sure you have insurances. There's a lot of HIPAA compliance. There's so much you have to involve when thinking about building in the space. But one particular thing that is interesting to me is the pricing model. And so I'll have you define a way to offer this level of service and care and technology. And has the pricing model always been the same? Or is it a subscription model? Is it kind of a full year access? What's the pricing model and has it always changed? And what's particularly, I guess, inviting about the way you've structured it now?
Yeah, so we've had to change over time because the market's changing. Our history in this country is a huge fee-for-service chassis. It runs all of healthcare, meaning providers, revenue, when they provide what they are doing. And there's a lot of issues with that. It creates a lot of misaligned incentives. However, that is the reality of how today the majority of providers are compensated. So when we first started the company, we realized that it wasn't necessarily the provider groups who were going to be incented to adopt this, because the health plan was the one who was paying for all of these specialty fees that we could help reduce. So we went early on to insurers across the country to get their support to reimburse for what we do. And again, they do it not only because it's improving access, but because we are carving out that specialty cost line item for them significantly. Now, over time, we have been moving more into what's called value-based care, which I'm a huge champion of, and that is paying providers for value and outcomes, not just for their services. In that paradigm, the providers themselves actually have skin in the game, and they're incented to drive costs down while also maintaining really good outcomes. And so because more provider groups are entering into these types of contracts, we have shifted our pricing a bit to give these groups subscription-based access where it can be all-you-can-eat referral management and eConsult, and they will pay for that directly. So we still maintain kind of two different models depending on the market.
Awesome. It's incredible to think about. And a lot of companies kind of struggle with this. I love to ask that question because it really helps kind of frame not only identifying your customer needs and giving them the tools that they need, but also how to make sure that the value is received from their end, vice versa, that it's this kind of cohesive relationship and not something that's hyper scalable and I'm not going to say predatory, but one that's not in line with the incentives of both the company and your customer, your target market. I always love to ask this question because I love the way CEOs, people who are building companies, extract knowledge from things that they ingest. So whether it's early in your career or now, what books or people have influenced you and impacted you the most?
Let's say people, I could list famous people, but the reality is that I'm probably most impacted just by my family and my close friends. I have like an incredible group of girlfriends that I've had now for 30 years, and they do everything under the sun, like everything from an avocado rancher friends and documentary filmmaking friend. Nobody does anything like what I do. So I've just learned so much from them and been able to just observe like how people are innovating and how people are solving problems that industries completely different to mine. And I've gotten a lot out of that exposure, honestly, just through my friendships. See, on the book side, I've read a lot too. I was an English major, so I love to read, and I kind of read gamut of things. I think that for me, you know what? One of my favorite books is a book I read last week. Honestly, it was a memoir called What Bravery Looks Like. And this book was just this incredible raw story about like how brutal and also beautiful, like basically being human is. And it's those sorts of stories that I think I learned the most from, especially for me working in healthcare. We're often meeting people at some of the most vulnerable and difficult times of their lives. So I think developing really strong compassion and empathy is just super important. So books that remind me of that, I really appreciate, because at the end of the day, like what we're trying to do at our company is just to help kind of improve this human experience and keep everybody healthy.
Yeah, it's incredible. I love asking that question because you don't always get the business books. You get other things, anecdotal stories, and really it's awesome to see how you connect those stories and things that you learn to even your business and what you do and how it's so intimate. And so I love that knowledge sharing bit. But last little bit, I know we're coming to the end of the show here, and I always want to give a chance to make sure that we covered everything. If there any question that I didn't ask you that I should have or that you would have wanted to answer, anything that we didn't cover that you would have liked us to?
Maybe just to give a reminder to anyone listening that be really proactive with your providers. If you're getting healthcare and if they're going to send you to a specialist, ask them if they can do an eConsult and just consult the specialist first. Be demanding about where they're referring you, because if you're not, you could be getting more costly care and you could be sitting on a wait list. So just ask the question of your provider.
Amazing. Brooke, it's been such a pleasure learning from your background, your experience, and also what Arista is doing and also what essentially changing this whole ecosystem and access of technology to really change a lot of the behaviors and give people the access to care that they really are seeking out and making it an efficient process. And what I've learned most in particular is the change from the physician side and the provider side to be able to give that care through technology. So it's amazing. It's been such a pleasure chatting with you. And last little bit is, where can we find you? Where can we find AristaMD? Give us your plugs. What are your LinkedIns, your websites, your Twitters? Where can we be a supporter of you and supporter of the company?
Yeah, go follow AristaMD on Twitter, on LinkedIn. Go to AristaMD.com. I'm likewise all over this platform, so appreciate you asking that question.
Thank you so much, Brooke, for being on the show. I hope you enjoyed yourself today.
Thanks for having me. This was fun.
Of course.